Today we examine the BaSIC trial, a critical comparison of normal saline and balanced solutions in intensive care.
Hello everyone, in this video we will shortly discuss about a trial called BaSIC trial which was published in 2021. So the clinical question of this trial was, in a broad population of critically ill adults, does the use of balanced crystalloid solution as compared to the normal saline reduces 90-day mortality? The first question was mortality reduction. And the second question was whether the slower infusion rate was superior to the faster one. Whether the slower infusion rate was superior to the faster one. So coming to the background and rationale of this study. So intravenous fluid are one of the most commonly used therapies in the critically ill patients. So traditionally, normal saline, 0.9% normal saline has been default choice worldwide. However, normal saline contain higher concentration of the chloride ion, which is higher than the plasma. So the excess of the chloride can lead to hyperchloremic metabolic acidosis, which can lead to acute kidney injury by various mechanisms like renal vasoconstriction. Whereas the balanced crystalloid solution like ringer lactate or plasma light L have electrolyte composition similar to that of plasma and lower chloride content. Despite the physiological concern, the clinical evidence remaining conflicting. So some earlier trial like SMART trial, SALT ED trial suggested benefit with the balanced solution, whereas other studies showed the neutral result. So in this study, the proposed hypothesis was the use of balanced solution is superior to the saline in reducing 90 days mortality. This was the hypothesis. So coming to the study design and methods. It's multicentric, pragmatic, 2 into 2 factorial, randomized control trial. It was conducted in 75 ICUs in Brazil from a period of May 2017 to March 2020. So it included all the patients more than 18 years admitted to ICU who requires at least one fluid bolus for volume expansion and who had more than one risk factor for acute kidney injury. The risk factor mentioned in the study was age more than 65 years, hypertension, sepsis, patient requiring mechanical ventilator support, patient having oliguria or raised serum creatinine, and patient having liver cirrhosis. And what were the exclusion criteria in this study? Age less than 18 years of age, patient requiring renal replacement therapy or expected to need RRT in next 6 hours, or patient having severe electrolyte disturbances like severe hypernatremia, sodium more than 160, or severe hyponatremia, sodium less than 120, and potassium more than 5.5, severe hyperkalemia, severe electrolyte disturbances, and the death expected in next 24 hours. So they excluded these kind of patient. Now coming to the intervention arm, patient were randomized in a factorial design into two intervention arm. First one was fluid type, second one was infusion rate. So in fluid type, they have given balanced solution in which RL and plasma light was there and versus 0.9% normal saline. And infusion rate, they have given slower versus faster rate. In slower rate, they have given 333 ml per hour versus 999 per ml per hour. In control arm, they have given 0.9% saline and faster infusion rate respectively. So what was the result of this study? So the primary outcome was there was no significant difference between the fluid type group. So there was no significant difference between the fluid type group. And there was no difference between the group based on the infusion speed rate. So whether it was fast or slow, there was no significant difference between these two groups. So in secondary outcome, there was no significant difference between the group in need of renal replacement therapy or change in Q-SOFA score at day 7. There was no significant difference.
Thank you for watching our presentation on the BaSIC trial. If you found this information valuable, please like this video and subscribe to our channel for more